Hi, welcome to the Growth Prescription, where we explore the intersection of modern medicine, technology, and smarter business growth. I am your host, Sridhar Eram Reddy. As the CEO of Steer Health, my mission is simple: eliminate the busy work that consumes healthcare and drive growth. Our all in one platform uses real time data and AI to automate operations and create seamless, integrated workflows, especially personalizing experiences for patients and staff. Today's guest is a perfect case study for this mission. Dr. Habib Dalhoumi of Inspire Wellness in San Diego helps patients navigate everything from advanced obesity treatments to aesthetic transformation. Beyond his clinical expertise, he understands a crucial truth. Modern patients demand exceptional convenience, what they see today in retail and everything else in life. We are going to explore how longitudinal care transforms outcomes, why operational bottlenecks are killing practice growth, and how Dr. Habib is using Steer Health's unified growth and automation platform from patient acquisition to biomarker insights to meet patients exactly where they are through the entire spectrum. This is the future of practice growth. Let's get started. Hi, Dr. Habib. Welcome to the show. Thank you for taking time from your busy schedule. We know that traditional healthcare or clinical care is symptom-based and episodic, whereas functional medicine and wellness is more longitudinal and personalized. Can you share, patient story that shows how a longer arc, change both outcomes and the way you run Inspire Wellness day to day? As we all know, traditional healthcare is very transactional, and I'd love to learn, how you started of wellness and functional medicine as a core discipline and how you have impacted several people's lives.
Oh, yes. No, I appreciate that. Sure. So I guess just a little bit about how and why and when I guess I started. I've been here now in my practice almost 14 years. I used to practice also in conventional medicine. I was in urgent care and emergency room here in San Diego, and I opened my clinic initially as a weight management clinic. And at that time, I feel like weight management had a little bit of a stalling. So we had to kind of pivot a bit, and what made sense, this idea of anti-aging and longevity started to kind of take off. So that's kind of how we started. I guess the clinic that we have today as a wellness practice. We kind of got into aesthetics and whatnot. You had mentioned about a patient or single patients. The beauty now is that we can do some amazing things for individuals that are outside of conventional medicine. Now, I feel like we talk a lot about insurance-based versus non-insurance-based, right? So, of course, a good deal of the individuals we treat today, they are part of an insurance-based system, and we like to think of that as, almost like sick care or catastrophic care or whatnot. And so we focus on all of the things that an individual would like to do outside of that space. I think at some point, hopefully in the near future, we can combine the two, right? So that insurance-based becomes wellness-based, and that would be amazing. But that's pretty much the start.
That's great. So you are basically doing the dual aspects of both functional and longitudinal medicine, and also you do support, people that are coming in for the traditional care system at Inspire Wellness in San Diego. Now, Dr. Habib, patients today expect almost like this one-click convenience or made for you recommendations, like similar to how they deal with Amazon, Expedia, or Spotify style daily mix, right? And their expectations are if I am doing this elsewhere, how come healthcare is not the same thing, right? Like, for example, scheduling, supplements, education, right? How are you looking at, because these people are always on the search for care, and they're looking for the best and easiest way to do business with facilities like Inspire Wellness. What's your perspective on meeting these patients where they are, and how they are looking and finding care, and how you are coming in front of them?
Yeah, truthfully, actually, that's kind of, I guess that's the goal in the end is to be able to get like deep personalized care as efficient as possible, right? Um, so I feel like that's probably the model, literally from the beginning to the end. I think in between, of course, we want to deliver the care that you would want and expect if it was yourself and you were, I like to kind of think that each individual that I see now is as if I was treating a family member. So we try to do that exact piece to deliver deep personalized care as quick and as efficient as possible. So that's why now I think, leveraging technology, I know we discussed a few of these things in the past, but the idea of um, making all of but connecting the dots, if we can make that as easy as and as efficient as possible, then we can spend the majority of our time in actually the deep personalized care. So yeah, so I mean, I think that's kind of how I would look at it.
Yeah, no, that's great to hear. And personalization really is the key word here, and understanding the traits or needs of the patients, and also following up on those things, with right kind of like aspects. Could it be biomarkers, or could be like things that you are trending, how things are trending, and then this is where I kind of look at it from the technology, how medicine is more going towards a kind of like very heavy data driven science, in the sense of how you're tracking things, how you're trending things, what are the right supplements and all of that. Dr. Habib, and obviously uh, clinicians like you that have really invested in that side, which is the wellness, and really helping patients to understand the root cause of the disease. I think this is fascinating side of medicine, and it's kind of like where I think we are all things are trending towards.
I agree. I mean, that's I'm actually working on a project now with a group, and it's exactly that. It's about delivering this idea of a longevity score, right? By biomarkers, by imaging, connecting your history, your genetics, and we all would love to know. I mean, when and how there may be an expiration date and how close it is, right? And what we can do to adjust that.
Yeah. And Dr. Habib, what are your thoughts on, obviously we have seen some materials and scientific evidence around, biological age versus, your traditional calendar age. Um, I know there are many factors that go into us, like, we humans have, obviously so many other traits that are like, not always in the medical record. That could be, quality, lifestyle, various other things that we uh, participate daily, and also how we are helping or not helping in the betterment of our own health. How do you see this, as an example, the biological age versus like, traditional age? And love to hear your thoughts and perspectives on it.
Yeah. No, I mean, I appreciate the question. No, to be honest, we're actually working on a complete algorithm to exactly to demonstrate that. And I agree with you 100%. I think it has a lot to do with all of those factors we just mentioned. And then, what adjustments can we make, and what does it translate to, right? Because at the end, if I can give an individual some score or some number and then tell them that, hello, the fact that they're still smoking, and they're fortunate because they may consider the fact that their grandmother died at 90 or 100 was a smoker as well, that it may give them space to do that. But if we can translate things a little bit differently, it's a different environment, right? They might have this hormone scenario, they might have this difficulty or this mental illness, or the fact that they've been eating this kind of food and whatnot. Now that tobacco is magnified for them, and how we can translate that in a score to get an outcome, so that someone might say, "Oh, you know what? Maybe I should stop now." Um, yeah, no. So I think it's amazing, and I think we can get closer and closer to a true, at least with like 95% confidence, a true score, and how we can adjust it.
Yeah, and that's a great, Dr. Habib, and especially we as patients on the consumer side, right? We're filling all these forms before the appointment, and there's so much data that belongs to us, and I think algorithms like that you referenced are really can be game changers in terms of like really influencing behaviors on people, what they should be doing more and what they should be doing less.
And how we can adjust. And that's the first time when I saw your Steve Jobs, I use him. I use him as a great example, right? Because he died way too early. And imagine from a healthcare scenario, right? And if we were able to give some degree of 95% confidence about how there were certain things that would, predispose to cancer and how and why. I mean, you can have all the money in the world, but yet we still have to have that space, that knowledge.
Absolutely. Now, Dr. Habib, moving on to the business of healthcare, again, kudos to you. It's not easy to, be an entrepreneur and stand up in a very pioneering business, way before when traditional, functional and wellness um, medicine was not the story of the day that you started this, right? And,
Right.
there are a lot of inherent challenges of, starting as a kind of like, clinician on practice and doing a lot of the things and the growth that comes with it. And I would like to frame this, Dr. Habib. Capacity is the new currency, right? As your time to care for patients and patients looking for care, it has to be managed as any other asset, right? To make sure that the people that are looking for care, the demand side, shaping them to come to you and making sure that your time is efficient and also preparing all the work. Unfortunately, in healthcare, there's so much of administrative work that goes into every patient's visit. And yet even though the staff is working, there's a shortage of staff. The costs are going up. Just wanted to hear your perspective on capacity and optimizing that to ensure that people looking for care are getting right answers, and also how you're streamlining some of those things.
No, you said it perfectly. I can even tell you that. So, for example, let's say we've had this practice now 14 years, right? Almost 15. At some point, I had 3 different locations. I probably had as many as 10 plus employees here, there, and for different reasons. Sometimes it was to get individuals in a certain area or not. But now we have one location. We're 3.5 employees, and we do probably double, I can imagine, at the greatest amount that we had when we were 10 plus. So it's exactly that. We are very good at what we do. We know the systems in place, and all of those other spaces, right? The dots in between that were 10 plus employees. Now that we've pushed into 0 or 1, we've been able to leverage technology in all those spaces. So we can give greater care, and individuals know that. I mean, now when they come in and they see a busy waiting room or whatnot, it's like, wow, we understand you're busy. They know that we're doing everything we can. Maybe soon they will say, maybe it's time to hire someone else. But we've been able to leverage all those spaces to deliver even greater care.
Yeah, and that optimization, right? Obviously, that's great to hear. Less is more, and things are more optimized. If you were to pick one bottleneck, Dr. Habib, from your lens, from the vantage point as the uh, managing director and medical director of these practices, what was the bottleneck? Is it phones, or is it like a lot of information coming in from patient referral or intake, or is it the follow-ups? People dropping off that made you say, "Hey, we need a simpler and automated way of doing business." And love to hear like some insights on what changed and for your team, and
Right.
especially your time and your bottom line, right? Perhaps.
Right. No, I think you brought up, like, those are probably 2 big areas that I feel like were bottlenecks that we were able to control quite well. And it's, fielding calls, anything that's coming in. That's a big piece. And then probably, the scheduling, and then also, like you mentioned, reminders and rescheduling and whatnot like that. That's huge. Before we would have to pick up phone calls, and if we didn't, returning messages and whatnot. And now we can, through a messaging system, we can connect with the patients, and they like that. They like the fact that they can message. We all get pinged, and we can see, and we can message back. Like, that's huge. The scheduling scenario is enormous. And I mean, even myself, we were testing all those spaces and whatnot when you schedule, and now you can connect, and when when you have an appointment and you get another reminder. That's amazing. And then after, even for reviews, I mean, that's a whole other space too. The fact that now we have, control over sending something immediate and personalized. And we even have something in our clinic that's it's a Vesta board. I don't know if you're familiar with that or not, but it's a messaging. Yeah, and we send messages like that just to patients in and out and whatnot. So these like little tiny, like, personalized pieces, I feel like that, yeah, that goes that but basically priceless, no doubt.
Yeah, and I think, Dr. Habib, that's really very kind of like appealing. Just knowing that level of personalization that's involved and how staff is equipped with the right tools. Now, the traditional systems, Dr. Habib, the EMRs, the electronic health records, and the traditional systems, right, have been built, especially in clinical care, very transactional, right? Like each patient has a symptom or issue, bring them
Right.
in, treat them, bill them, close that. They call it encounter, and then close the encounter. Whereas we are not encounters, we are really a longitudinal health relationship. And how do you? I mean, that's one of the biggest challenges, especially for practitioners like you, that's looking at wellness, more
Yeah.
longevity, and data centric care. And labs play a big role. Supplements play a big role. However, there is systemic gaps in EHRs, right? And that can somewhat inhibit the effectiveness and efficiencies, right, of a practitioner and how you can streamline things.
Yeah, no, I think the best scenario there is to have real time data, like you were mentioning. So labs is great. We need that. I think the future is really heading direct towards all the wearables. So any kind of real time data now, and that's another piece that we're working on, which is to collect real time data. For example, let's say I have X amount of patients that literally have my own personal cell, right? So they can send me information. All that information that they're sending me, I would love to be able to do it through one platform where now, without even thinking, I can see the data comes, and of course we're already worrying about that individual's blood pressure, and now of course I have direct data. I think that's going to be a huge play in the future. Labs is amazing, and we can now order all these longevity markers and whatnot. But when we can connect that with real time data, like basically it's like carrying your pulse at all times. Yeah.
Yeah. And one of the things we bring at Steer Health here is really around that, personalized biomarker data set with the AI insights to showcase where, things are off mark and where things are trending right ways, and being able to guide the clinician before the visit. And also, you touched upon very important thing is really the what I call like the biometrics, way beyond what we know is like the sleep activities and other things from wearables and stuff, right? Again, these are key indicators of of our lifestyle and other things, right? So with that, those in mind, Dr. Habib, obviously, just moving on to the next step, which is like thinking behind a lot of these things you optimized, right? You chose to build your patient engagement automation with Steer Health. What was the core thinking, or what were you looking for? And you talk a lot about leverage and simplifying things, right? Can you expand on what you were searching for before you chose to work with Steer Health?
Yeah, I mean, I think it just boils down to the fact that we can hire staff and we can train, and we're our clinic. We're a big teaching facility, so we have a lot of medical assistant students, nursing students, nurse practitioner students. So quite a few individuals come in and out, and so we get to see the different levels of engagement, right? From an individual as they're learning. So when we've done that, and same thing, like you can invest time and energy in an employee, and they can be amazing, and then they can move on. And I encourage that typically, right? And then imagine the most amazing employer, and then move, and now we have to redo the situation again. So we've looked at the spaces where maybe it can be more automatic, and how we can bring technology to do those spaces, right? And that way, the individual at the front can literally just do what they're doing and be great at it, and smile, and that it allows us to give that extra special space of care, in the human touch, and then everything else that doesn't quite need that. How can we use that and automatize that, and leverage technology to do that? So that's what we were looking for. And I mean, all you have to do is be creative, and you can figure out, wow, I guess we can, maybe this part, we can just kind of put that, and make it relatively simple, and add the human touch in between. And that's what we look for. And that's
Yeah.
what you guys have been able to do nicely.
Yeah, thank you, Dr. Habib. And one of the things we fundamentally believe really is that orchestration of repeatable tasks that are really that bog down the staff every day. And how do you really create systems where they humanize and amplify the productivity of the staff, right? So it's like a person using platforms like Steer. And there's a lot of hype with AI, and everyone everywhere is AI this, AI that. But the reality
Yeah,
of it is, what's the process? Where does technology fit in? Where it enters and where it is out. So your human capital is maximized when their potential is realized. I think that's how we look at things. As an example, like reducing no shows. Again, there's so much work that goes into preparing the patient's visit. How can we personalize each journey, customizing their preparations, right? That's how
right.
we kind of take pride in how we deliver solutions.
Yeah, no, and that sounds great. And I agree with that. Like, we're not sending messages trying to, send a message that sounds like it's human, but it's not. No, no, very quickly. I think that's what individuals respect, the fact that when they get a message, they realize, okay, this is, automatic, but that's all I need. And right now, an automatic message is not so bad. Right. And then when a personalized message needs to come through, then, we have those platforms in place.
And yeah, that's great, Dr. Habib. How does this kind of technology, kind of like projects empowering your staff, impacted the human side of your practice? So, like sometimes especially with what I call like this Silicon Valley phenomena, right? People say, oh, AI will replace all the jobs. This will happen. That will happen. They create this kind of like it's a kind of it's kind of like fix all panacea or something. From the perspective of what you have seen, right? How did human side, your staff, your patients, your clinicians, how did they embrace technologies like Steer Health?
Yeah, no, I mean, I think that's exactly right. So, for example, when we have a very very direct messaging system, and the individual knows if it's us, hi, this is Sarah, she's the nurse. I will say hi, this it's the doctor here, period. And other times it might be simple, okay, this is your appointment, or it's time to get you labs. But those kind of things we always personalize, and we put our name and information, and I think patients respect that. Of course, if they have an appointment, they get a reminder, and they know that might be automized. It's automatic and whatnot. But the fact that we've used spaces where I feel like we haven't abused it, right? Then I think the individual really respects
Yeah.
that. Yeah.
That's a keyword I think is really respecting the patient and using what we call from the technical terms a conversational methodology. Even though it's machine, it's acting like a human on your staff's behalf, right? So, Dr. Habib, what's the biggest piece of advice you would give to a practitioner or a group that's focused on functional medicine wellness, who is feeling stuck, right? They see these patients, they have to review all these tons of information that comes to them before, and they're struggling with capacity and you know higher costs of labor, turnover, like you mentioned. What would be your single biggest piece of guidance and advice?
Well, yeah, that's a good question. So, um, I think it's very important to just almost look at the whole experience. So, from the patient or the individual, the client calling in to schedule, or how they even found. Once they're there, they're scheduled, and then they come in, even walking in your door, and then from there, signing paperwork, from signing with your hands to digital, whatever it is. I think it's really good to look at the whole experience, right? From as a provider, just as a third party, just do this kind of like a Freudian look as a third party. What is the entire experience from beginning to end? And then you ask yourself, as the provider, where would I like to spend the majority of this visit? And that's what I do. Like, I virtually literally am no part of any of it. Sometimes I don't even know how to work some of the buttons at the front. So I just know that once they're in my office, then it's literally like, I capture that space. And now, that's it. We're stuck in this space together. And then once they leave, I direct into the next phase. So I guess my point there is that through that whole journey, there are many different ways to do each space. And I feel like if you do your space super well, and the other pieces you either delegate or you utilize technology or whatever it is, today, all those other spaces can be done well, and you just focus on your space.
Yeah, that's amazing, Dr. Habib. I think you nailed it. I think really the idea is creating that operational blueprint around, from patient acquisition, where they're coming in, meet where they are, and then driving them to the right point of care, but also ensuring every touch point, what can be automated, where is, human in the loop. And then, obviously you are experts, you're delivering great care and driving outcomes for the patient. And also, once they leave the four walls, what are the things you can augment to bring them back and make sure that longitudinal engagement is happening on your behalf? Because there are not enough bodies in the world to really reach out to people. So that's where I think the technology and highly personalized outreach and creating what I call the traditional, what they call stickiness in the retail. Because
100%.
health
Yeah.
is the most important thing we got. And, people like you, the leaders in healthcare, driving this kind of, augmented things around traditional sick care, I think is really noteworthy and really excited that, these things are growing
Yeah.
yeah.
No, I appreciate and I agree 100%.
Thank you so much, Dr. Habib. Really, before we end this conversation, anything else you want to share?
No, I mean, I think that was really that kind of nailed it all. You're absolutely right. No, I like the fact that what you just said too, because you can have a tremendous visit. And I think in the past we used to, we were not probably the best at follow up, schedule. Nowadays it's like, okay, when somebody leaves, you give them appointment already. In the past it was just, okay, no problem, enjoy it. That they're gonna come back because of the result driven success, right? But you're right; those other pieces, they actually matter. Now when we do a certain type of a toxin, we use something called Javo. They have a special app, and it just sends them the message after 3 months, and it might be time for you to come back and enjoy this savings or whatnot. So, all of those pieces have made the whole journey a whole lot easier.
Great, fantastic. Thank you so much, Dr. Habib. I appreciate your time and have a
My
great
pleasure.
rest of the day.
Thank you.